Hello. This week marks 2 years and 1 month since the World Health Organization declared COVID-19 a pandemic. The last 25 months have been unprecedented, but we're now looking beyond our emergency response phase in reacting to COVID and have begun to put plans in place to support our COVID-19 health and social recovery. Funding for this was approved in the government plan, and work has been ongoing since the start of the year to support these initiatives. Firstly, the COVID Recovery Fund supports various programs to address the gaps in children and young people's learning, which has been caused by the pandemic. Part of this is a targeted program of initiatives aimed specifically at supporting children under 5 and their families. At the weekend, we launched the 50 Things to Do Before You're 5 app, and this free app, developed with Best Start Partnership, will help to support families and children to develop positive health and well-being habits in the early years. We're rolling out multiple initiatives in primary and secondary schools to reverse any widening gaps between students and to tackle learning losses. And this includes art projects, a Jersey tutoring program, a summer school provision with an academic focus, reading recovery to improve literacy levels, and funding mathematics training for selected education staff. We'll be increasing the capacity of children's dental care to catch up following the disruption caused during the pandemic. We've provided funding to Highlands College for around 20 free courses over a 16-month period. The courses are targeted at islanders with limited or no qualifications, and the delivery of these courses will support islanders' future employment opportunities. We are exploring new and innovative methods of social prescribing to assist groups particularly affected by social isolation during the pandemic, and we're also going to be improving our data gathering and research abilities. And we've invested in support for those living with long COVID symptoms, including the establishment of a dedicated clinic in February, which has so far seen 96 appointments for islanders, with 100 future appointments now booked. We've put funding into a countryside access scheme to improve access to green spaces. Access to Jersey's beautiful countryside and green areas was so important to islanders during the pandemic, and we will be engaging with community groups and volunteers to enhance Jersey's footpath network and help more people enjoy our countryside. The period of the pandemic has been difficult, but we believe that initiatives like these will help in the continued recovery of our island, with targeted support to help islanders after the challenges of the last 2 years. Thanks for listening.